Ghana this week became the first country to receive COVID-19 vaccines through the Covax program. 600,000 AstraZeneca doses arrived in Accra Wednesday and over 500,000 in neighbouring Côte d'Ivoire on Friday. The World Health Organization-backed initiative aims to provide at least 2 billion doses to lower-income countries. Joining me now is Bloomberg's West Africa Bureau Chief Yinka Ibukun in Accra. Thanks for your time, Yinka.
Thanks, Marc Daniel.
So certainly a historic week for the Covax program, but what's been delivered in Ghana was, of course, enough jabs for just 2% of the population. So how much optimism is there on the ground that this signals a wider rollout is on the way?
It's a historic day for Covax. It's a historic day for vaccine equity. And so there's a lot of optimism among countries that may not necessarily be able to afford to vaccinate their entire populations, that at least they would get some support from donors.
Yinka, we know that Ghana is looking to purchase vaccines directly from manufacturers as well. What do we know about these plans so far?
So what we know about Ghana's plans is that it does plan to vaccinate its entire population of 30 million people. So the 600,000 vaccines that it got through the Covax program are really just a drop in the bucket. It has a lot more to do if it wants to reach its ultimate objective. So it's in talks with different manufacturers. We know that it's budgeted $15 million to buy 20 million vaccines, which would cover much of the 30 million population. Through Covax, it's entitled to 2.4 million vaccines. So even if it gets its full allocation, there's still a lot to do, and work is underway to achieve that.
So the Covax vaccine program, for all its good intentions, is still facing major hurdles in achieving its goal of vaccine equity. We've seen groups like Amnesty International warn that 9 out of 10 people in many low-income countries are not likely to get a jab in 2021. So, Yinka, what does this global scramble for vaccines mean for many of these low-income countries in the West Africa region? What options do leaders have?
So Covax is one strategy, obviously, because it's basically free to the economies that qualify for it. But obviously, that won't be enough. At best, Covax would provide vaccines to 20% of the population of any member country. And so if really any country seeks to vaccinate its entire population or much of its population, it's going to have to look beyond Covax. So countries are looking at purchases, they're talking to manufacturers. As in Ghana, countries are approving other vaccines for use. There's also a great deal of vaccine diplomacy. So we've seen already before Covax, there had been Chinese deployments of Sinopharm vaccines with much fanfare in places like Zimbabwe and also in Senegal. And so you're going to see definitely a mix of that, of donations, purchases, but also some vaccine diplomacy to ensure that as many people have access to the vaccine as possible.
That's Bloomberg West Africa Bureau Chief Yinka Ibukun in Accra. Thanks for joining us, Yinka. And I'm Marc Davies in London. You're watching Quicktake.